Good day, I am Islime Del Rosario from BSN 111B, Group 6. Today, I will perform hand washing return demonstration. So, hand washing is known to be one of the most effective ways in preventing the spread of microorganisms. So, before we start, make sure to prepare and ensure that all the materials needed are complete. So, I have here my antibacterial soap, my paper towel, of course, sink with running water, and a trash can over here. Lotion is also used in this procedure, but it is only optional. Completeness of the materials needed in a procedure will help us nurses to be organized and to perform the procedure effectively. So before we start, make sure to cut the nails short to minimize harboring microorganisms, scratching the patient, or puncturing the gloves. Make sure to also remove all the jewelries since microorganisms can lodge in the jewelries or under the rings. Also, check your cuticles, hands, and forearms for cuts, abrasions, or lesions because a nurse with cuts or open sores may need to do other work assignment to prevent the transmission of infectious organisms. So, as I can see, my cuticles and hands do not have any cuts or open sores, and so I can proceed with the procedure. So to start this demonstration, I need to stand in front of the sink, making sure that my uniform is not touching the sink because this area is considered to be contaminated and we want to prevent the spread of microorganisms into our uniform. Next, I am going to open the faucet and make sure to adjust its pressure to avoid splashing. So water splashed from the sink is considered to be contaminated and we don't want to contaminate our uniform. Now, I am going to wet my hands, starting with my wrist area, pointing my fingers towards the bottom of the sink. So this is because the water should flow from the cleaner area down to the more contaminated area. Now, I'm going to get my antibacterial bar soap. So lather the soap thoroughly in a circular motion because this creates friction that helps remove microorganisms mechanically. Now, I am going to interlace my finger at the back of each hand. Make sure to also do this on the other side. Now, I am going to rub palm to palm with fingers interlaced. Now, I am going to rub the back of my finger to the opposing palm with fingers interlocked. So interlocking and interlacing the fingers ensures that the interdigital spaces are clean and washed properly. Do this also on the other side. Now, I am going to rub my finger starting with the thumb. Do this also on the other side. So rubbing mechanically helps loosen the dirt and microorganisms. Now, I am going to clasp my finger and rub it to the opposing palm. Make sure to also do this on the other side. Now, make sure to also rub the wrist area. Now, I am going to rinse off my hand on a running water. Make sure to rinse off thoroughly and inspect for dirt or remaining soap. Now, I am going to dry off my hands using a paper towel, starting with the fingers down to my wrist area. I'm going to discard this paper towel and I'm going to get another one. So from fingers down to the wrist area. Do this also on the other side. Then discard the paper towel. Now that my hands are dry, I am going to turn off the faucet using a paper towel to prevent touching the faucet. This is to prevent the transmission of microorganisms from the faucet into my hands. So if we do touch the faucet or any area in the sink, then we need to do the whole procedure all over again. And make sure to discard properly all the paper towels used. So that's it for my hand washing return demonstration.